Good day, everyone. Welcome. I'm happy to have you back. In this session, we will be discussing renal and fluid electrolyte geriatric clinical care. Before we continue, let's revisit our previous lesson. In the previous session, we discussed atypical respiratory presentations in older adults and identified early indicators of respiratory decompensation, explained the concept and clinical significance of silent hypoxia, and identified aspiration risk due to airway protection failure, and integrated functional, cognitive, medication, and comorbidity factors into respiratory assessment. By the end of this session, the learner will be able to 1. Describe normal age-related structural and physiological changes in the kidneys. 2. Explain reduced renal reserve and its impact on fluid and electrolyte regulation. 3. Recognize atypical presentations of renal dysfunction in older adults. Let's begin by knowing what changes occur in the kidneys with aging. With aging, the kidneys undergo predictable changes like 1. Structural changes, such as progressive loss of functioning nephrons, reduced renal mass, decreased renal blood flow. 2. Physiological changes such as decline in glomerular filtration rate, GFR, reduced ability to concentrate or dilute urine, impaired sodium and water regulation. It is important to know that the kidneys will still work, but they will filter blood more slowly and adapt poorly to stress. Next, we'll look at what reduced renal reserve is. Renal reserve refers to the kidney's ability to increase function during stress. In older adults, baseline creatinine may appear normal. Adaptive capacity is limited. Small insults can cause a rapid decline. The clinical implication is that a normal creatinine does not mean the kidneys are safe. Moving on is how renal dysfunction presents unusually in older adults. Older adults often do not present with classic renal symptoms such as flank pain or dysuria. Instead, renal dysfunction may present as confusion or delirium, reduced appetite, falls, fatigue, decline in mobility. Let's summarize what we've covered so far. Renal and fluid electrolyte disturbances are common and dangerous in older adults due to age-related decline in kidney function and reduced ability to maintain balance. It is important to know that early recognition through understanding age-related changes, unusual presentations, and risk factors are essential to prevent rapid deterioration and serious complications. We've come to the end of this session. See you in the next video.